Hey everyone, and thanks for checking out this lecture from CyberMD. This lecture will cover split S2 heart sounds for the USMLE Step 1 exam. Split S2 heart sounds refer to the variations in the timing of the aortic and pulmonic components of the S2 heart sound. These variations can provide important diagnostic information about the heart and its function. Let's jump in. Physiologic splitting refers to the normal variation in the timing of S2 that occurs due to the delay in the closure of the pulmonic valve relative to the aortic valve. This occurs and becomes audible during inspiration as the reduction in a person's intrathoracic pressure leads to an increase in the venous return to the right heart. Remember that during inspiration, the diaphragm moves downward to expand the thoracic cavity, causing a decrease in pressure. Consequently, there is an increase in right ventricle filling as blood and oxygen are pulled into the thoracic chamber. Increases in right ventricle stroke volume and right ventricle ejection time are observed as well. This increased ejection time is what causes the delay in pulmonic valve closure. Wide splitting occurs when the right ventricle has a delay in the emptying process. This means that conditions such as pulmonic stenosis or a right bundle branch block may cause this condition. In pulmonic stenosis, the stenosis of the valve means that greater force is required to force the valve open, and more time is required to generate this force. In a right bundle branch block, the electrical conduction of the signal sent for the right ventricles to contract is delayed, and so the closure of the pulmonic valve will ultimately be delayed as well. Furthermore, inspiration will delay the emptying even further due to reasons previously discussed, exaggerating the already wide split. Fixed splitting, above all else, is exactly what it sounds like, a fixed split of the S2 heart sound. This type of split remains constant throughout the respiratory cycle and is not affected by inspiration or expiration. Typically, we think of this being caused by an atrial septal defect. The shunting of blood from the left side of the heart to the right side of the heart through the defect causes an increase in right heart volumes, both in the right atria and the right ventricle. As mentioned during the piece on physiologic splitting, there is a delayed pulmonic valve closure with this increase in volume. Again, it is very important to note that this is occurring independent of respiration. Lastly, paradoxical splitting is defined as a reversal of the normal pattern of S2 splitting, with the pulmonic component preceding the aortic component. In these conditions, the aortic valve closure is delayed. This is heard better during expiration, the opposite trend of physiologic and wide splitting. Conditions that can delay the closure of the aortic valve include both aortic stenosis, with the same mechanism as pulmonic stenosis discussed earlier, as well as left bundle branch blocks with the same mechanism as a right bundle branch block discussed earlier. In summary, split S2 heart sounds refer to variations in the timing of the aortic and pulmonic components of S2. These variations can provide important diagnostic information about the heart and its function. Physiologic splitting is normal, while wide splitting, fixed splitting, and paradoxical splitting are abnormal and may indicate certain cardiac conditions. These conditions can be caused by a variety of factors such as congenital heart defects, acquired conditions, or damage to the bundle of his or other electrical signaling systems. Proper diagnosis of these conditions require a thorough history and physical examination, as well as additional testing such as an electrocardiogram or echocardiogram. Thanks for watching and listening in, and be sure to subscribe to our content.